Well, good evening and welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic will be ketamine, a very interesting topic and a very interesting subject that has brought a lot of attention to a new form of medical treatment that's helped countless numbers of people with certain lifestyle medical conditions. First of all, I want to thank everybody for joining us. This is the first webinar in our series for the first quarter of 2023. And we have a lot of very interesting webinars coming up. I'll talk about them in just a moment. But I'd like to introduce tonight's co-host, Turner Davis. Turner is with the New Horizon Infusion Clinics. Turner, tell us a little bit about yourself, your clinics, and what you're going to be talking about tonight.
Hey, Mark. Like Mark mentioned, my name's Turner Davis. I'm a pharmacist, been a pharmacist for almost 20 years now. Got involved with ketamine infusions about 3 years ago when sort of a spinoff of working. I also work with medical marijuana treatment clinics in helping patients that have had a hard time with traditional medications to find relief, essentially. So, what we've learned with the ketamine infusions over time is that they can be very effective for patients with treatment-resistant depression or PTSD that have tried, many other avenues of treatment, and they're really looking for for some, nothing's worked for them. So they're really looking for a therapy that has a very high rate of success with patients that may have failed other types of treatment. So, that's sort of the history of how we got involved with it. And I look forward to sort of, explaining a little bit about ketamine infusion therapy and how it may help individuals who need it, essentially. So,
Turner, before we begin, ketamine is really in the last year has really become kind of a popular, or I should say a trending treatment. Why did it take so long for this to come out?
Well, so there was work on ketamine for, obviously ketamine's been around a very long time, but work on ketamine for treating depression and pain and those sorts of things really started, in the late 90s. And a JAMA report, the Journal of American Medical Association, came out in 2006, identifying with a pretty thorough study that ketamine could benefit patients with treatment-resistant depression. Then more work was done on it in the intervening years. And then in 2017, actual guidelines were published by the JAMA Journal of Psychiatry that, really sort of solidified the fact that ketamine is an accepted treatment for certain chronic mental health conditions. And then in 2019, 2020, the FDA actually approved a ketamine nasal spray for depression, which even further solidified the science behind using ketamine for conditions other than its original purpose which is anesthetic. So really it's just been an evolution over time. And, like anything, it sort of gets to a critical mass or breaking point where enough people accept it as a therapy that, it starts to get a lot of attention. And it can be pretty dramatic. I mean, that's the interesting thing about, ketamine infusion therapy. We're talking about patients who have had lifelong battles with depression, lifelong battles with PTSD. And then all of a sudden, this treatment is really, getting them to function again, getting them to their families to finally see the loved one that they used to know and those sorts of things. And that's a really powerful human interest story. And I think a lot of the media outlets picked up on that. So,
yeah, but I think it's something that it's proven. I know the government's been using it for a while, and it's something that, how should I say, is worth taking a look at if you have a certain medical condition. So why don't you tell us a little bit about it, what you do, and the pros and cons?
Yeah, well, I'll go ahead and jump into the presentation here. We can get rolling on it, and this will answer most of the questions, I think.
And by the way, I might want to mention to everyone, please feel free to ask questions. There's a Q&A button that's right down over here, and it's something where we're here to answer your questions. So I know this is a new topic, and there's no such thing as a bad question. So please feel free to bring them out. But I might want to mention while Turner's doing that, that we are having the medical marijuana and wellness webinar series this quarter. We're starting with ketamine. Next week, we're going to have an interesting topic, which both Turner and I are going to talk about, which is B12. Something that I've discovered over the last quarter that's really helped me quite a bit, and I hope a number of people tune in for that. I think the other is the week after that, we're going to be in the villages with a live seminar on medical marijuana 101. And then we're going to have a number of interesting topics, not only arthritis and pain, but this quarter we're going to be tackling cancer, neuropathy, sleep, terpenes, and of course dosing. So this webinar series is something that's been done for you. It's being right now it's being live streamed on Facebook. And I do want to mention that again, we are here to answer your questions, so please feel free to do that. That's really one of the main topics that we're trying to do, or one of the advantages of this is you can get questions answered for a very important topic that it's hard to really find a lot of information about. So Turner, take it away.
Yep, absolutely. So, like I mentioned before, ketamine, when we're talking about ketamine infusion therapy specifically, we're talking about a therapy that is used for several conditions, mental health conditions such as anxiety, depression, post-traumatic stress disorder, and also for some chronic pain, specifically those chronic pain conditions that really focus around neurologic pain like fibromyalgia, migraine headaches, those sorts of neurologic, neuralgias, those sorts of neurologic conditions that can also be very hard to treat with traditional therapy or may not respond well to it. But when we get to like we mentioned before, ketamine has been around a very long time, but it has not been used for these mental health conditions or for chronic pain necessarily for a very long period of time. That's what's sort of novel about it. It was a re-examination of a very old drug that, doctors started to realize there may be some additional benefit. Those patients that, use ketamine for its intended purposes as an anesthetic, all of a sudden started to have better mental health outcomes. And they started to dig into that and look at that and realize that, hey, there may be something here with ketamine that we didn't realize before. And that's not uncommon for a lot of drugs that have been used for a long time, that they may find new uses for them as the years go by. But, ketamine, again, been around since 1962. It was used mainly in wartime to start with as a battlefield anesthetic. It works very quickly. It's very effective as an anesthetic. It's sort of unique in its chemical structure, and that's why I think it did evolve over time into being used for more than this. But it has hypnotic, amnesic, and analgesic or pain relieving effects, which it's really the only drug that has that combination of effect on the human body that's available. So I think that's why we see it being used now for a variety of fairly disparate and unique conditions and being effective.
Turner, I saw a movie and it was about those boys that were trapped in that cave, and I think it was in Asia somewhere, Southeast Asia.
Yeah, they
had to bring them out. Remember, they're in there for a number of days, and they brought them out. It's a very, very fascinating movie. I think it was called 18 something. Anyway, it was interesting. They used ketamine to basically put them to sleep so they could carry them out. It took quite a while to get them out, so they wanted to make sure they were calm. But the interesting thing I read about that is not only did it help calm them to be able to bring them out, but also afterwards it helped them quite a bit to be able to help get over the trauma of that particular experience.
Yeah, no, that's it. Yeah, the amnesic effect there, that's really a unique thing about it. And there have been some studies done that showed giving drugs that have a hypnotic or amnesic effect, even administering benzodiazepines right after a traumatic event can actually reduce the instance of PTSD development down the road. And I think that's, but unfortunately, most people don't have the opportunity to have access to that right after a traumatic event. Sure. But the good thing is that with ketamine, apparently, the mind or the brain can sort of use that chemical to sort of get the same effect down the road as opposed to just to use right after the event. So, but yeah, no, it's interesting. They're discovering new things all the time about the way the mind or the brain, integrates trauma, integrates memories that may cause issues later in life, and the more they learn, the more they sort of have new novel ways of thinking, how do we get around this? How do we teach the brain to to get around this roadblock that it's running into. And that's sort of the goal or the theory behind, a lot of why ketamine sort of works this way.
Yeah, for people who don't know, why don't you explain what JAMA is?
So JAMA is sort of the gold standard of medical journals in America. It's the Journal of the American Medical Association. To get published in JAMA, it's very difficult. You have to have a lot of peer review, a lot of very strong evidence and well-designed studies to be published in JAMA. So for that reason, it's sort of the reference that the medical community goes to especially for new therapies and new discoveries. And so to have ketamine therapy for chronic or treatment-resistant depression, rather, be published in JAMA was a big deal. And it really opened the door for a lot of individual research, practitioners using it in their clinics, because again, ketamine's been around a long time. It's a safe drug. We know it's safe. So there wasn't a big risk, and still it isn't a big risk of adverse events when used in clinic setting under medical supervision for these types of treatments. So, that allowed physicians to be able to do some smaller scale studies over time and again, get that stamp of approval in 2017 for JAMA, again, publishing sort of guidelines on how to use ketamine for these conditions, which is even a bigger, another step down the road from just saying, hey, it works, to, hey, we have evidence of this is how it should be best used, which was very helpful. Again, that really opened the door for a lot more practitioners to be comfortable using ketamine for these alternate conditions that it's not actually FDA approved for. These are all still considered off-label uses from what the FDA has approved ketamine for, but there's very strong evidence behind it. And again, like I mentioned earlier, there is actually an FDA approved ketamine product for depression. So there was strong enough evidence for a drug company to get, it's not actually ketamine, it's S-ketamine, which is a ketamine derivative, which allowed the drug company to get a name brand patent on it. But it's essentially the same type of therapy in a nasal spray. But again, it's available through several routes. The only FDA approved route for depression is through the nasal spray. IM injection and intravenous therapy, it is FDA approved for anesthesia, but again, used off label for these chronic pain and mental health conditions. And the sublingual troche is usually a compounded product, which means a pharmacy makes it specially for a doctor that requests it. And some of the companies out there are some online companies that have kind of focused on the sublingual route because it's easier, honestly, to use for patients. But unfortunately, there's not a lot of evidence out there that it works in as effective a manner as the intravenous therapy, the injections. It kind of goes in that order of intravenous therapy being the most effective because it goes directly to the source. You get the most bioavailability. The body has the most exposure to ketamine through the intravenous route. It doesn't have to go through any processing. It goes directly into the bloodstream. Injection is next. It's injected into a muscle. So it does have to go through a layer of processing before the body gets to use it. And the nasal spray would be the third most effective. Again, a little less bioavailability. You do have to use the nasal spray every day, which is another downside. And it's very expensive because it's a name brand, which is another downside. But that is available from the FDA. And then the sublingual would be the least effective with the least evidence that it works well, but the easiest to use. So, this also kind of goes down effectiveness of routes, also kind of goes down the easiest to use as well, which is, unfortunately, like a lot of drugs, the most effective routes are the most direct, and the intravenous is certainly that with the ketamine. So when we talk about how it's used or sort of the ways it's available, that's the broader picture of what's going on out there in the marketplace right now.
Now your clinics mainly specialize in all four of those treatments. Is that correct?
No, we really focus on the intravenous route. So our clinic focuses, we've taken the evidence. We want to focus and spend our patients' time and money on the most effective route of treatment and make sure we get the best outcome. So we really just focus on the intravenous at this point. There has been some evidence that after the initial induction series, which I'll talk about here in a minute, from the intravenous therapy, that maybe sublingual may be a good option for maintenance therapy down the road. in conjunction with talk therapy. But again, right now we were sort of focusing on the intravenous route, with boosters to maintain that effect. Mm-hmm. So, again, well, I'll discuss a little bit more about those options as we go along here. But for us, New Horizon Clinics really kind of focuses on the intravenous route at this time. And again, that's based on the studies, right? So the studies really support those JAMA articles that I mentioned earlier, really support, all of those studies were done using the intravenous route. And they have shown that low doses of ketamine infused over 1 to 4 hours can improve a lot of conditions that are non-responsive to standard therapies. And when we say non-responsive, that's, you usually tried 2 to 3 of your standard antidepressant medications, or 2 to 3 anxiety medications, and you still are suffering from those depressive symptoms or having episodes that is affecting your quality of life. And really that's what all this is about. It's about improving quality of life. It's about finding a place where you can function well, compared to your, to get over the depressive symptoms that are affecting you on a day-to-day basis. The doses are only about 25% of those that they use for ketamine in surgery. It's weight-based, so usually anywhere from 0.5 milligram to 2 milligrams per kilogram, depending on where you are in the induction series. The goal for ketamine therapy is relaxation and mild dissociation under medical supervision. That's really the whole crux of what we try to accomplish in the clinic setting. So we want patients to be in a mild dissociative state they're still awake enough to respond to us. So the nurse usually goes in and checks on a patient while they're getting therapy about every 5 to 10 minutes, make sure they can still respond, hey, Ms. Smith, how are you doing? And, get a thumbs up or whatever it may be. So, if a patient gets too sedated, then we usually will back off the infusion rate, let them recover and kind of go that way. But the goal is not to put someone all the way under. The goal is to, get your mind into that disassociative state and let it start kind of remapping. And that's what, the ketamine therapy, and there's also been some work done recently on other psychoactive therapies, and they sort of have the same theory. They're letting the brain view itself in a different way and figure out a way to get around these roadblocks of trauma or whatever it may be, to function better at the end of the day, essentially.
Turner, we had a really good question that came in. It's from Marlene. It says, does a practitioner need special credentials to administer ketamine?
Yeah, so there's some basic training CE courses that a practitioner will take, usually from the American Association of Anesthesia, but it's because it's not full sedation. The level of training does not need to be as intensive. Again, you're not putting someone under for multiple hours and having to maintain airways and things like that. It's much simpler than that. So it's more of a outpatient therapy. You could sort of compare it to a dental procedure or something like that. As far as the level of sedation goes, it's very mild. So the level of training does not need to be as intensive as that. But the practitioner does need to be there. They're all either physicians, nurse practitioners, or physician assistants, those that have a higher level of training than just a nurse or a non-clinician. They do have the ability to, they are practitioner level doctors or secondary practitioners that typically have, the folks that we employ at the clinics have a history in infusion therapy, a background in emergency medicine, those sorts of things that give them a healthy background to understand, how to respond if something, rarely does go wrong, which is, again, very rare. There's a lot of this infusion therapy going on all over the country. And it's just very, very low risk. There's just very, because the good thing with ketamine is that it's very fast acting. So when you turn it off, the effects go away. You have maybe a minute or 2 minute window that a residual effect when you're using the ketamine through an infusion. When you turn off that pump, that a patient doesn't immediately start to come out of out of the ketamine state there. So it's that really helps it to be easy to control for the practitioner in the clinic. And of course, there are some comorbidities that you have to watch out for patients if they have uncontrolled high blood pressure. That's something we have to monitor closely, or if they've had cardiac events, the ketamine can increase your blood pressure. So we do a good screening before a patient comes in to make sure they're good candidates for treatment. So that in itself really prevents a lot of problems if as long as we do a good job on the front end, making sure that the patient is a good candidate.
And that's a good point. I think before you begin or have people go through the ketamine treatment, you have a medical professional who actually does some screening to make sure.
Oh, absolutely. We have a pretty thorough screening process. We do, try to obtain medical records in most cases for patients, from their primary providers before we approve them for therapy. We'll do an interview with them just to make sure, they're seeking the therapy for the right reasons, obviously, for this. So yeah, no, it's a process, but it's one that at the end of the day, these patients that we treat are typically pretty far down the spectrum of therapy that, just hasn't worked for them. So they're really, it's a lot of hope and we get a lot of good results. So it is worth it's worth the process for most patients. We've had very few that have just walked out the door thinking, well, this was a waste of time. It's really helped quite a few, the vast majority of our patients, which the studies back up. You can see when you read those studies, a 70 to 80% response rate for these treatment-resistant depression patients, which is pretty extraordinary, honestly, for someone who's not responded to anything else.
Right.
So, just quickly on how ketamine works, I don't want to get bogged down in all this too much. If anyone's interested, you can really dig into this online or however you may want to. But, ketamine is an NMDA, antagonist. So NMDA plays a lot of roles in both pain and the way the brain functions and the way we perceive the world, honestly. And the fact that the ketamine will block the NMDA receptors makes it a unique treatment. There's not a lot of medications out there that focus or really block those NMDA receptors. So, a lot of the antidepressant effects that it has are mediated. NMDA receptors are normally stimulated by glutamate in the body. So by blocking those receptors, you allow the body to keep more glutamate in the nervous system, which really kind of allows the nervous system. Glutamate's very stimulating. It's one of those things that kind of keeps us going. And as opposed to serotonin and some of the other pathways, norepinephrine, those sorts of things that normal antidepressants work on, glutamate is a separate pathway that ketamine works on, and it has, it gives another mechanism of action that may not have been attacked by traditional therapy. And I think that's one of the theories as to why we see the response rate is the role that these glutamate and NMDA receptors play in depression and these sorts of long-term conditions. So being able to affect that pathway is a unique mechanism of action of ketamine that gives us another tool, essentially. See it. I've got a quick video here. This is only about 2 or 3 minutes, but this is a patient that actually received ketamine infusion therapy. And I think she gives a very good description of what most of our patients describe while they're getting ketamine treatment and the results after. So, I think it's always good to hear from someone who's gone through it. So that's why I kind of wanted to share this, and I'll play this quickly here. Again, it's short, but informative.
It looks like a spa.
Alexa, play meditation music.
A place Rachel Bush has gone to unwind.
Is the music loud enough?
It's loud enough.
But this is a medical procedure where Rachel is being treated for PTSD, depression, and anxiety with an injection of ketamine.
The past few months were rough.
After an assault that nearly killed her, she was prescribed antidepressants that just didn't work.
I was contemplating suicide, wishing that I had been finished off.
Then someone told her about Dr. Quan Henderson, owner of Mindscape Ketamine and Infusion Therapy.
It kind of helps kind of remodel the brain, the way it feels about certain things.
Ketamine affects your brain's neurotransmitter called glutamate. You can liken it to how Zoloft affects the neurotransmitter serotonin. Ketamine often gets a bad rap because of its history with people abusing it. Its street name is Special K, but it's been used in medicine for decades.
Ketamine is an anesthetic that's been around for 50 years, but in the last 15 years it's actually been used for treatment of mood disorders that are resistant to certain medications.
Dr. Henderson opened this practice after ketamine helped his wife, Stacy, who'd battled depression for years.
I couldn't believe it. It was just such a wonderful, life-changing experience for me.
KHOU's mental health and wellness expert Bill Prasad warns ketamine has addictive properties, although it's on the lower end of the spectrum. He says ketamine should be used sparingly and hand in hand with therapy. The FDA has not approved injecting ketamine for mood disorders, but the VA hospital does use it to treat PTSD and reports positive and immediate outcomes.
This is a miracle medicine.
Rachel says it worked on day one for her and describes the experience like this.
It's almost like I'm slipping away into a good dream. And things just start to make sense. Something changes. You see that you're not in crisis mode. You see the light.
Dr. Henderson says the effects can last months to years, depending on the person.
In my opinion, it's a cure for depression and PTSD.
That's very interesting, Turner.
Yeah, no, I mean, it's always powerful to hear, someone who's actually gone through the therapy talk about it. And, I have not used it myself, so I'm not a firsthand, unfortunately, can't share firsthand experience, but I think, I have spoken to many of our patients after they've received therapy, and we hear a lot of very similar things. The rapidity, how fast it works is really remarkable, honestly, and that's what a lot of those studies were most surprised about, was how fast a lot of these patients felt better. Usually, and I'll get into this here, but again, you have an induction series and then maintenance as needed. So when a patient after that first induction series starts to feel symptoms or starts to feel like they may not be functioning as well, they'll come back and get a booster, and they usually only need a booster every couple of months. It's something that's really it's a maintenance process, but it's not one that's very intensive after the first infusion. So,
Turner, we have a very good question from Peggy. She says, "Can the PTSD definition include trauma of surgery, like breast cancer surgery?"
Yeah, no, absolutely. I mean, PTSD is the triggers or the instigating trauma for PTSD doesn't really change the nature of what PTSD is. I mean, it's your brain reacting to trauma in an unhealthy manner, and it really doesn't matter what the trauma was. It's just something that, as unfortunately us as humans are sort of wired to internalize. And but yeah, no, absolutely, the ketamine could help with that. The root cause doesn't really affect the outcome for most patients. So after assessment, like we talked about, they go through the assessment process, which is, again, an interview to see if they're a good candidate, then a review of their medical records, and then approval for therapy. So once they're approved for therapy, you'll start off, and this is a mental health protocol. The protocol for pain and mental health is a little bit different. Mental health, you get 6 1-hour infusions over 3 weeks. So you'll get 2 the first week, 2 the second week, 1 the third week, skip a week, and then 1 the 5th week. And then, so that's typically how we'll do it. So that's not actually accurate over 3 weeks. It'd actually be over 5 weeks, but I need to correct that. But anyway, that's how the normal induction process goes. And then typically the patient will move to a maintenance schedule, and they'll be, and we usually see improvement over each infusion. So that's, if a patient gets to the 4th infusion and we haven't seen any improvement, which would be the end of the 2nd week, and they're still saying this isn't helping at all, we'll typically discontinue therapy because, unfortunately at that point, it's unusual for a patient to respond if they haven't responded after the first few infusions. But typically the patient will improve more and more as each infusion goes. And then, when they get to the end of that induction series, they're at a maintenance phase where they can get 1 infusion a month or as needed. Really no, again, like that news story said, there's no rhyme or reason to how often a maintenance infusion may be needed. It really depends on the person. But typically a month every other month is normal for most patients. And again, studies really back up a very significant response. 70% of treatment-resistant depression and up to 80% of PTSD patients will respond to ketamine infusion therapy. So again, I stress if you've tried everything else, this is a little more intensive therapy. It's a little more inconvenient, but it has changed the lives of a lot of patients that we've treated, and it's been,
Well, the fact, first of all, that it has such a high effective rate. And number two is the fact that you're taking a look at, let's say after 4 weeks, if it's not working, you're kind of abandoning it. You're being very careful about this. You're
No, exactly.
No,
I mean,
we're a solution for the patient.
Yeah, no, we're not out to sell snake oil or take any money, take $1 from a patient that, isn't for a treatment that's not working, so it really isn't, if it's not working, it's not working. We'll move on. But again, we rarely see that, fortunately, that it doesn't help. So, there's not a lot of that that we have to disappoint a patient with, fortunately. So this is just a little bit of evidence backing up, that induction series with multiple doses. And you can see, with the number of infusions, the response rate goes up. Here, 1 infusion, 2 infusions, and then, you maximize the effect at 6 infusions. That's where that induction theory comes from. It's actually backed up by clinical trials by evidence and data. So for chronic pain, again, the regimen is a little bit different. And honestly, with pain, pain doesn't respond at the same rate as the mental health treatments. You get about a 50% response rate with pain, because again, pain is so dependent on the, on what's happening in the body, where the pain is originating, those sorts of things. So it's, for those patients that it works well for, it's typically, like I mentioned before, something that's very, very neurological, or very, in nature. Not one, if you have back problems, or if you have, a bad elbow or bad knee, something that has a lot of inflammatory component to it, the ketamine therapy is not really going to help as much as it does with something, again, like neuralgia or fibromyalgia that doesn't really have a root cause, but it's more, your body's overreacting, and your nerves are just frayed and fired up and causing a lot of pain. So, and again, that which, is a harder, those types of pain therapy, or pain conditions rather, are harder to treat. Complex regional pain syndrome, fibromyalgia, the persistent migraine headaches, neuropathy, they can be very life altering and affect quality of life. So, if you do suffer from something like that, you just haven't found a lot of relief, and this may be something that's worth trying. But as far as the initial treatments goes, it's usually a larger dose. We'll start a little bit higher dose, usually 2 milligrams per kilogram. We'll start the mental health therapy at usually 0.5, and then work our way up to 1 or 2 by the end of the 6th induction infusion. But you want to start with a larger dose for the chronic pain, and usually only do 3 treatments, typically 3 2-hour infusions. The infusions are longer. Because you're really trying to get your entire body rather than just a specific area of the brain to settle down with the ketamine infusion. So you want the body as a whole to have more exposure to the ketamine and the medication. And 3 2-hour infusions over 7 to 10 days, and then we move on to a 1 infusion every 1 to 3 months as needed for a maintenance phase on that. So the length of the infusions are longer, but there are fewer of them in the induction series, and then again go to the maintenance schedule 1 every 3 to 3 months as needed.
Turner, we had a couple of good questions. Anonymous question from someone says, does ketamine therapy help with those with fibromyalgia, with chronic pain? And the answer is it probably could.
Yeah, no, absolutely.
It just probably could.
Yeah, no, fibromyalgia, definitely one of the conditions that we see treated, that responds better to ketamine therapy than some of the other ones I mentioned, like back pain or knee pain or those sorts of things. So really, again, if it's neurological in nature, there's probably a better than 50% chance that the ketamine would help on that. One of our nurses actually has a neck problem, and that she had dealt with for years. And when she started with us, she asked the doctor about maybe trying it out, and it's been a lifesaver for her. And then she says it's very similar. It lasts about 2 months, and then she has to get another infusion, and it'll last about 2 months. So, it is a maintenance thing as it goes along, but for someone like her who had some nerve damage or something going on in her neck, it really worked well. So and helps her function, pretty much normally, honestly, on a day-to-day basis. So.
Yeah. And in turn, Natalie asked a question, and she used a word that I can't even pronounce, so I'm going to not try. I don't know if you can see her question. It says, "Does someone with pseudochlorines, I can't pronounce it, abnormality, is it advisable to consider ketamine just for chronic pain, not with no symptoms of anxiety and depression?"
Yeah, no, absolutely. I mean, it's you don't have to have the comorbidity of the mental health condition. Although, there are some, like fibromyalgia, like some of the other conditions that does have a anxiety component to it that can, benefit both ways as well. A lot of the patients we see, we have the discussion, hey, should this patient be treated for the mental health side or the chronic pain side, because they have both, because a lot of times they are, the one kind of drives the other, honestly, and helping one can help the other, but not necessary, no. But, again, like I mentioned, it's really just more of what's the root cause of the pain as to whether or not ketamine will be beneficial. And if the root cause of the pain is neurologic, nerve damage, overactive nerves, or those sorts of things, then it can certainly benefit from something like ketamine. If it's more structural, bad shoulder, bad knee, inflammatory, those sorts of things, ketamine is going to have limited benefit more than likely on those types of pain conditions.
Yeah, Michael also asked a great question. I think it fits into this category. It's he has a degenerative disc disease with chronic pain. The half-life, I don't know if you can see it with the Tranche method, and exactly what does it help? Exactly how does it help with pinched nerves? It says he's experienced ketamine for depression, and he's been diagnosed with PTS from Vietnam. He has slight amount of stress and anxiety. I guess the question really comes back to, could it help him?
Yeah, well, I mean, it's again, helping the stress and anxiety. Many studies have shown that increased stress and anxiety will make pain worse. The sensation or the way we perceive pain worse. But also, ketamine, when we're talking about how it works on pain conditions, it basically changes the way nerves behave. It calms them down. That NMDA, glutamate, actually plays a very important role in the transmission of pain signals. And so by blocking that glutamate from binding to those NMDA receptors, we can actually sort of dull the sensation of pain. Actually, a lot of studies on medical cannabis have shown the same thing. It also has a role in that NMDA pathway that can help pain from another pathway other than the traditional ones that we use, such as the anti-inflammatories or the opiates. Opiate has its own dedicated receptor in the body. Our bodies are made to use opiates in a certain way, and this, using ketamine in conjunction with your normal pain medication can provide another layer of action that it was not available, from the medications you're taking. So, for example, if you're using an opiate for pain, it doesn't do anything for the inflammation. It doesn't do anything for the glutamate receptors. So by adding an anti-inflammatory, adding an occasional ketamine infusion, you're attacking it from multiple different ways, and that's where some of the benefit could come in. From using it for pain that way. Again, if back is difficult, a lot of times there's a lot of nerve involvement in the back, because of obviously, structural facts of the way the back is, contains the spinal nerves and things like that. But again, if it's not going to, the ketamine is not going to reduce the inflammation or any of the improve any of the structural issues that are going on there, but it can help improve the perception of pain and the ability to deal with it on a day-to-day basis. So that's sort of the thought process there.
Cool.
So if you're interested, if this sounds like something that you've had some of these conditions you've been dealing with, it sounds like a good option for you. How would you start ketamine infusion therapy? Your first thing would be to contact a clinic, either New Horizon Infusions or somewhere else that does ketamine infusions. Obtain your medical records for a physician review. Most doctors are going to want to see, if you have a pain specialist or a mental health specialist that you've been seeing, it's beneficial to have. It's not necessary, not 100% of the time. That initial interview that you'll have with with one of our providers before you come in, that will tell us a lot as to whether we need further records or not. But if you are approved after the initial interview, after we review the records and you'll schedule your appointment, it's important the day of your appointment that you would hold any medications and no food that should be no food for 12 hours, no drink for 4 hours before you come in. And, of course, all that would be provided, information would be provided before, because ketamine can cause nausea. That's one of the big side effects of ketamine infusions and why, the longer infusions can be a little more problematic. But we do typically add Zofran or some other anti-nausea medication to the infusion to prevent that as you're getting the infusion. But that can be a side effect, so that's why we ask you to hold drinking food. The experience in while you're getting the infusion, you're going to be relaxed in a dimly lit room with if you like music, we encourage patients to bring headphones or anything they usually use to relax. And then then after the infusion, you'll kind of hang out for 20 or 30 minutes while you recover. The doctor will kind of make sure you're not having any trouble or problems after the infusion. And then you will need a ride home. So no driving for 24 hours after the infusion. So we will require that a patient has some sort of transportation from the clinic after the infusion. We won't let them drive home, or if they, insist or do, then we will discharge them as a patient, because, obviously that's not something we can allow a patient to do after getting a 2-hour ketamine or an hour or 2-hour ketamine infusion. So those are sort of the ground rules. Pretty simple, honestly. Again, it's a little inconvenient because of the transportation issue. It can be problematic, but for most patients, again, it's a short window of time where you're getting these induction infusions. So it's 2 a week, 1 a week, and then you're done for every other month until except for the maintenance infusions, which aren't nearly as intensive.
Turner, one of the questions that came up from Peggy is, it says, as a treatment, how do you treat like car accident pain and also PTSD from those events? Yeah, I think having been in a car accident, I can see where the PTS.
No, absolutely. No, and that's something that we would determine, from our initial interview. Our provider would interview you up front to kind of see what's the best course of action. Like I mentioned before, we have a lot of patients who could go either way. They have chronic pain, but they also have mental health conditions, and a lot of times, treating that PTSD will help them deal with the pain a lot better. Improve their quality of life just from that. Just from improving the symptoms of the PTSD. So it really depends on the interview on an individual patient, but we do take all things into consideration on that. And we've done 100, 200, close to 300 infusions, I think, at this point since we started. So we've got a good bit of experience with patients and knowing kind of what works and what doesn't as far as the protocols go and what a patient may benefit from. But again, it's hard to tell without looking at all the details. But the answer is it could be either one, honestly, depending on your own personal situation there. So, side effects quickly from ketamine infusion therapy: nausea, again, being the big one, can cause elevated blood pressure. That's something the doctors will monitor. You'll be hooked up to a blood pressure monitor while you're getting the infusion, just to make sure your blood pressure stays where it needs to be. Hallucinations, excessive sedation, obviously that's, ketamine is an anesthetic. So some patients are a little more sensitive than others. We do have medication that the doctors will give you if you do get a little too sedated to bring you back around. And then also the option of stopping the infusion too is there. So, not a big risk on that, just something to be aware of. And that's why the nurse will come in and check on you every 5 to 10 minutes, make sure you're doing okay. And then we also have medications that can reduce the effect of ketamine. So if you're taking Lamictal, Xanax, or benzodiazepine, naloxone, those sorts of things, we would ask that you hold it for 24 hours if possible. It's not a deal breaker, but we do to get the best effects, the best outcome, ideally, it's best to hold these medications, at least as long as you can, close to 12 to 24 hours before you take, before you do the ketamine therapy, just to make sure we're getting the best results. Not dangerous, it's just about getting the best outcomes on that. So that's why we ask you to hold those medications. Sure. Intravenous ketamine has a half-life of only, like I mentioned, 5 minutes. So side effects, typically resolve within 1 to 2 minutes of turning off the infusion, because we're using a low dose anyway. So, on top of the short half-life, it's a low dose. And so there's not a lot being pumped in there. Cost, the problem with ketamine infusion therapy, a lot of patients run into, unfortunately, is the cost. It's not FDA approved for treatment of depression or chronic pain. Therefore, most insurances won't cover ketamine infusion for off-label use. There are some that will. This is changing slowly, and we will, and most clinics will provide assistance with you asking for reimbursement from your insurance company after the fact, but they won't allow our doctor's office to bill directly for the ketamine infusions for these certain conditions, outside of surgery. That's really the only approved use for it.
That kind of answers the question about, does the insurance company pay, right?
Yeah, so it's hit and miss. We are getting a few that we can get, we can get reimbursement from, but it's certainly not a guarantee, and it's I would say 80% of insurance companies do not cover it. So it would be a challenge for that, but it is. For us, the depression PTSD, we're actually at $300 for the 1 hour treatment, and then $450 for the 2 to 4 hour chronic pain treatments. A lot of doctors' offices are a lot higher than that. We try to be reasonable on that and keep our costs down on the infusion side, but it is something you should probably shop around a little bit, make a couple of phone calls, compare prices if it's something you're interested in. So, typically the cost of a full cost for a mental health treatment will be, will be around, $1,800 for the induction series, and then, $300 every 1 to 2 months. So again, it's not out of hand for what it is, especially for those patients who really, have tried a lot of other things. When we talk about improving the productivity of a person, the ability to get up and go to work, the ability to earn money by, improving your quality of life, improving the way you function, it's probably a worthwhile investment. It wouldn't take long to recover $1,800, if it'll get you to, go from a part-time job to a full-time job, being able to function better on a daily basis. So that's sort of the calculation every patient needs to make. Hopefully over time, again, more and more of these types of treatments will be paid for by insurance. For example, the VA does pay for ketamine infusions, those sorts of things, through their community care program. So, that's a good sign. The fact that we are seeing some movement in the insurance field on that there. So as far as a pitch for us, I do work with New Horizons Infusion Clinics, and again, like I mentioned, we are one of the lower cost providers out there. We're physician supervised. All of our we either use a doctor or a nurse practitioner, but even the nurse practitioners have immediate access to ask a doctor a question, and all of our nurse practitioners have a lot of infusion experience. That's one of the things we really look for when we're bringing a new person on staff is they're very comfortable with infusions. We do have therapists on staff and access to someone who, if you don't have a therapist, we have a couple that we work with that are great, that patients really like. We do really stress, the outcomes are better for the mental health therapy or the mental health treatment when you do have some talk therapy to back up, the ketamine therapy. So, we think that is important, not required, but, I think we do advise and strongly urge patients to take advantage of that. And then, we do have some specialized patient care software that will, track your improvement over time if you so choose, and allow, our staff to see how you're doing and maybe, track how you're doing as far as maintenance therapy and when you might need, some, an additional booster or something like that. So, that's good information for you and the provider on that. So I appreciate the
A couple
time
of
tonight.
questions here before you end. If you
Yeah,
don't
no,
mind.
absolutely.
Yeah.
Let me back out of the presentation here.
That's it.
If I can. Well, let's see.
So one of the questions that comes up is from Michael is why do we need greater disassociation for pain treatment versus taking it via other methods?
Well, it's not really, again, it's the exposure time is not necessarily the disassociation with the pain, although it does help your brain again remap the way it perceives pain over time. Again, it's about creating these sort of new pathways, new neural connections in the brain for, retraining it a little bit to function in a different way. But, the longer exposure the nerves and the neurons have to ketamine, the more effect it's going to have longer term on how the nerves act and behave and perceive that pain. That's sort of the theory behind it. Again, it's hard. There's no hard evidence to back up the mechanism of why this works, but the theories that are out there, seeing, based on these neurologists looking at the mechanism of ketamine versus the mechanism of how the body perceives pain and those sorts of things. That's the working theory, is that it's really a remapping process, and that takes time, for that to happen. So that's why we keep the drug on board for that extended period of time. The alternative is taking a daily dose through a nasal spray or one of the troches that may or may not have the same effect, as opposed to these shorter, more intensive doses. Over time. So if you think about, say 6-hour infusion as opposed to taking an oral dose, to get the same amount of drug into the system from an oral dose, to keep it on board as long, ketamine breaks down quickly. That's sort of the trade-off there that we see, and sort of the benefit, I think, that the literature backs up, that has a lot more backing on the infusion side than on the oral side. So
Sure. Now there's a couple other questions that came in, and I think that I'm going to kind of combine a couple of these because they came in from anonymous, and I'm assuming it's the same person. One of the questions is, what's the difference between ketamine and the mushroom theory? Because there's been a lot of talk about mushrooms as well.
yeah, so I mean, overall the theory is similar, honestly. With ketamine causing, especially for the mental health side of it, you're basically helping the brain find a new pathway to get around these roadblocks of trauma or pain or whatever it may be that it's gotten stuck in a rut of working this way, and we're trying to get the brain out of this rut, basically. Trying to show it a different way to work around these broken pathways or interrupted pathways. So psilocybin, those sorts of things, the theory is they work in a similar manner, remapping, helping the brain sort of work around some of these other problems, and it's something that I'm excited about. I look forward to being able to add psychedelic assisted therapy to the regimen of New Horizon clinics as we grow. Right now, of course, it's not approved, not legal for those uses, but there are a lot of rumblings that, especially MDMA, which is the ecstasy, on a street drug. There's been a lot of work done with MDMA and talk therapy. The patient takes an MDMA tablet, undergoes an hour or 2 hours of talk therapy, and they've really shown a lot of benefit from that. So the FDA is actually expected to approve that for in-clinic use, sometime at the end of 23, early 24. So that may be another option as well. Outside the psilocybins and things like that. So
I think one of the advantages of your clinic is you have professionals that work with the patients to help them on their particular condition.
Well, that's the key. That's the key thing, and really what makes a lot of these things therapy as opposed, or treatments, medical treatments, as opposed to, just recreational use. When someone uses ketamine on the street, they're taking it just to get the dissociative effects as fast as possible, as quick as possible. There's no moderation of the dose. There's no consideration for a controlled setting and letting the brain work in a subtle manner as opposed to hitting it with a hammer. And I think that's the difference, why we see some of these additional benefits Again, a lot of it has to do with the longer exposure time to the drug with the infusions and things like that. I think that's a lot of the theory of why it works. So yeah, so I mean, it is the proper setting, the proper monitoring is important on all of these things to get the best outcome. So.
Great. Peggy asked a really good question about, or made a very good comment about the presentation in the comments. I should mention, as a follow-up to this session, we're going to be sending you an email that has a copy of a link to the video, which will be on YouTube. It'll also give you a flipbook version of the presentation, so you'll be able to follow that if you missed a few of the things, and then also the links to the clinic and places where you get your questions answered going forward in the future. So you will get a follow-up email. It's not a matter of just having to remember everything. That we will do the follow-up that's here. One of the other questions that came up is, will it help with patients with schizophrenia and other mental conditions?
So schizophrenia is a tricky, there are some mental conditions out there that we do try to, that are not, that ketamine is not appropriate for. If a patient has, dissociative episodes, whether it be mania or schizophrenia, those sorts of things, we obviously don't want to disassociate them further. So schizophrenia, mania, certain types of bipolar disorder, if there's a mania component to it, may not be appropriate for ketamine therapy. But again, that's something that our clinicians would look at during the interviews, during the medical records, and determine whether that's a good fit or not.
Great. And you are only in Florida. I think that's one of the questions that's asked.
Yes.
So a question from from Anonymous is, if he's out of Florida, so the question is, what medical professionals should they approach out of state? And
Really,
candidly, I think if they get a hold of you, send you an email, you could probably recommend some people.
Yeah, absolutely. And just Googling ketamine infusion therapy near me. I mean, that's an easy way to do it if you're out of the area. There's likely some providers out there. Again, the keys to, there are good actors and bad actors, just like every other every other medical treatment out there. So just make sure to read those Google reviews, make sure they're well medically supervised as far as appropriate clinicians and in appropriate settings, and they're not just there's a difference between trying to get the right kind of patient and make sure they respond well, as opposed to just giving anyone who calls up and asks an infusion, no matter what the condition is. So just be aware of that. If it seems like, hey, that was really easy, they just talked to me and told me to come in and get an infusion, that's probably not the one you want to deal with. You want to use someone with a little more caution, probably, than that. So
yeah, I mean, you're serious about providing solutions and heading that path. And I think if that's the path you want to head down, something to take a look at, because I know cases where people have suffered from depression for years, and as the lady in the video showed, this was like a life-changing event. And though that's very important. I think I've talked to a couple of people. I have a friend of mine who ketamine has helped quite a bit. And he was at the end of his rope, is the best way of putting it. And his comment was, why did I wait so long? I mean, he should have tried it earlier, but it's something that has had positive effects. And to be blunt, if you see that it's not working, you'll stop it. In other words,
exactly.
You're just not out there to just take people's money. You're there to help and provide a solution.
No, absolutely. Yeah, I've always been a big believer in wanting a patient to be happy when they leave and want to come back to us. I mean, that's the thing at the end of the day. So I had a good experience up front, good outcomes. We have a relationship for a long time, and that's sort of our goal at the end of the day. So
Good. Any other things you want to bring up? Because I think we pretty much answered all the questions. Is there something you wanted to bring up?
I think I'm good. I appreciate the opportunity, and any questions that come in after, I'll be happy to shoot emails or whatever it need be. So
yeah, I want to thank everybody for attending tonight. I know we'll send you a follow-up email that'll have a link to the video. It'll have the presentation, the addresses, the contact information, some data about ketamine, and it's something that hopefully will help you. I mean, our goal is, if we have one person get their life back from watching this video, we've accomplished what we wanted to accomplish.
Absolutely.
And I think that in talking to yourself and a few other people, this has been something that's been very effective. And I think it's something that people should really pay attention to. And Turner, I thank you for your time tonight. I know that this is a new subject, a subject that's not a lot of people know about, but hopefully we've answered some questions and help people get back on track. Let's put it that way.
Absolutely.
So anyway, anything else you want to add?
All good.
Good. Well, listen, Turner, thank you very much for your time tonight. I want to thank everybody for attending. We really do appreciate your time and interest. Next week, we will be talking about B12. And that I will be able to talk about firsthand because I've been using it the last quarter, and it's helped me tremendously. I've been shocked at how well it's helped me. So we'll be taking on that. And I hope everybody has a good week and a good weekend and stay safe. And for those that are out of state, especially anybody from out west, stay safe. Have a good weekend. So thank you very much.
Thank you.